Okay, so this is really the last mat exercise for the arm. This one was just added a few days ago by the therapist. Now, in therapy, they don't have something to lean on, so in the middle of the mat, it's really difficult, and you need somebody to help stabilize the upper arm and elbow. But I've kind of discovered that if I just do it against the couch, that holds my elbow pretty much in place where it needs to be, so that I can isolate and really exercise, the muscles that are intended. And the idea is to keep the elbow at 90 degrees and to use those external rotators to rotate the arm upward. Now, when I did that in therapy, I could not get it all the way on my own. I needed assistance. And already in 2 days, I'm almost able to get it entirely up. There we go, I think we're there, by myself. Now, these are supposedly really important because without these muscles, once you raise your own arm above 90 degrees, you don't really have any control or movement in it. These muscles really aid a lot in the movement and control of your arm once they're above 90 degrees. So hopefully the next time you see me, I'll be cranking these out a lot easier than I am today. That. Okay, so the other important thing that I do with the arm and the hand is, trying to work the dexterity of the hands and the fingers. Like I said, not so long ago, I really couldn't do much of anything with the hand. It still tends to want to tighten up. And during this exercise, I do have to kind of stretch it and straighten it a few times. But as you can see, I can actually close it and make a fist. To a certain degree, I can open it, can't open it quite as easily as I'd like to, and that's all part of the whole clenching thing. Once it clenches, it doesn't want to unclench. So what I do here is I bought these little blocks because they're a nice size, they're lightweight, and they allow me to really focus on the grasping and releasing functions of the fingers. So I usually start out using my good hand to assist, get this towards the end and even hold it in place while I can try and wrap my fingers around it. Now, it really is all in this right hand, the ability to pinch that block, not lose it, and then once I get it to where I want it, to be able to release and let go. 2 weeks ago, I could not do that. Couldn't do that at all. Now I think I'm getting quite good at it. I tried to vary it up some by making these blocks twice as big so that I have to stretch my fingers out twice as far. And it may not seem like a lot to you, but indeed it is holding twice the weight. And then I even try sometimes to try and grab two of them this way, which takes a little more dexterity and control because you've got to be right over the gap, the pinch between the two. I try to do, and this is again the therapist really riding my butt and making me do things as hard as possible. So if we stay out here now, try and do some without using the left hand for assistance. So, my right hand, not all that dexterous, but at least I can use it as a club, if you will, to just push things around. And then move that bucket away further so that I really have to stretch. And now I can't move my feet, so that's getting me to shift some weight down to my bad leg and to really stretch the arm out a little further. So now you're starting to see a little more arm involvement in this whole exercise, not just the hand. So it takes time, and And, you know, I gotta be patient with it. I can't be in a hurry like I usually am. That right there, I think, is probably the best I've ever done. I've never really been able to reach it out quite that far. That's pretty cool. I'll do one more. I don't necessarily think you have to tape all of this. I'll come back and finish this exercise later. So, that's the primary, you know, specific exercise I do for hand dexterity. Well, I do try to use the hand as much as possible all day long, just normal functional stuff. So if I wanted to come here and get something out of the pantry, up until 2 days ago, I'd use my good hand, I'd open it, I'd looked and seen what I want. Now I'm learning how to be patient, because I might be in a hurry to find something to eat, but instead I have to take my time, use the right hand, make the right hand do more, find what I want. Maybe I want these Cheerios. What's the chances of me grabbing them Cheerios and bringing them out here with the bad hand? Not always able to get it, so maybe just a little assistance with the good hand, and I can get something happening here. It looks pretty pitiful, I'm sure, and hopefully the next time you take me, I'll be doing better than that. Again, you know, it's early on, so it doesn't hurt to assist a little bit. Yeah, that's that. But definitely try now to do as much as we can with that hand. I should be able to turn the lights on with that hand. Again, it's not the way you would turn the lights on, but I can do it. And the whole idea is that the more you try, the more it'll work. One more thing that I do, not as often as they'd like me to, but and she actually wants me to go outside today and wash the car. Again, it helps loosen everything up, so you know, you can use your good hand to help move things along, but it gets you to stretch. So kind of like wiping down the counters, yeah, maybe. But now when we go out, now that's how I started. Now the idea is to go out and wash the car. Well, on the car it's not all flat and horizontal. Now you have some vertical surfaces. And again, these fingers want to curl. Sometimes you just can't fight it, you just let them curl. So now you're getting different motion by working vertically this way. We'll see. It's pretty warm out, but I do think I'll go out and wash the car.